Good evening, all. My name is Jonique Love, and I am a senior nursing student at Winston-Salem State University. Immunizations are an extremely important aspect throughout an individual's life that protects us from preventable diseases, which could lead to drastic complications, including death. There are many diseases that are very common in the world, such as polio, measles, diphtheria, pertussis, also known as whooping cough, rubella, also known as German measles, mumps, tetanus, rotavirus, and Haemophilus influenza type B, known as HIV, which can now all be prevented by a series of vaccines starting from birth. When you are born, you develop a passive immunity, which includes antibodies from the mother that is passed down through the placenta as if the child was a fetus, or through breast milk when the child is an infant. However, immunizations provides us with active immunity, which exposes the body to a specific antigen, which generates an adaptive immune response. To further get where I'm going, the main vaccine that I will be talking about today is MMR, further known as measles, mumps, and rubella. The CDC recommends that the MMR vaccine is given to protect us against infections known as, again, measles, mumps, and rubella. The 2 doses of the vaccine, one given within age 12 to 15 months, and the next series at ages 4 to 6. If you are worried about getting the second dose earlier, that's okay, as long as it is 28 days after the first dose. Isn't that pretty flexible? Also, extra protection is given for a child due to passive immunity from the mother, but only up to a year, which is why the second dose isn't required until 12 to 15 months. Now, let's break down all 3 of the diseases in this category to describe the effects negatively of not getting vaccinated. It's all about protection. Measles is an extensive viral disease that is airborne, such as when someone coughs or sneezes. The symptoms of this disease could be a fever, cough, red eyes, or even a runny nose. Next, you will produce a rash that has small spots in them. And this rash starts from your head and goes down to the rest of your body. Now, let's get into some statistics. Before the immunization was created, about 34 million of U.S. individuals were infected by the measles. However, only 500,000 cases were reported each year to the CDC. Out of the cases that were reported, up to 500 people died, and 48,000 were hospitalized, and 1,000 people experienced encephalitis, which is swelling of the brain. But on a brighter note, since the introduction of the vaccine, there has been a 99% reduction rate of this disease, which is very intriguing. Mumps, next, is also a viral and contagious disease with flu-like symptoms such as fatigue, weakness, a headache, loss of appetite, and also in muscle aches. With 2 doses, there is an 88% effective rate versus 78% effectiveness with the first dose. Prior to 1967, when there was no vaccine, the mumps were very common in childhood illness. Now, due to vaccination, there has been a 99% reduction in cases in the United States. Rubella is a viral contagious disease. Most may intertwine rubella with German measles. However, they're just German measles. However, it is caused by a different virus compared to the measles. If infected with the measles, one may develop a sore throat, a rash, starting from the face descending down with a fever. Further complications are even more pronounced in a pregnant woman, which can lead to miscarriages and prominent birth defects. 1 dose of the MMR vaccine is 97% effective. Due to vaccinations, rubella has been extremely decreased overall. Per the CDC, the MM vaccination is very safe and effective. 2 vaccines will produce 97% effectiveness versus 1 dose being 93% effective. The complications of unvaccinated individuals not only produce effective on themselves, but these not only produce a negative effect on themselves, but they also produce a negative effect on others, which is very important because you're not vaccinating yourself, but you're also giving a risk to someone else. Now, let's take a breath. I know you all are wondering the positive side effects of the vaccines and also the contradiction of this vaccine, of getting it. According to healthychildren.org, if you are pregnant, if there's a weak immune system, any condition that causes easy bruising and bleeding, a recent blood transfusion, has tuberculosis, or gotten any vaccines in the past month, 4 weeks, or aren't feeling well, you may have to postpone getting that vaccine. Side effects of the MMR vaccines are minor effects such as a sore throat, fever, rash at the injection site, and swelling of the glands such as the cheek and the neck. These usually begin within 2 weeks after injection and less evidence with the second dose. I thank you for visiting my vaccine hesitancy message, and I hope that I drastically changed your mind about the importance of this vaccine for a healthy life. Thank you and have a great day.